let's talk about fibroids during pregnancy today. Now, what are fibroids? They are the commonest muscle growths of the uterus. They are almost always benign and are not cancerous. Now, there are three main types of fibroids depending upon where they are located on the uterus. So, you can have a subserosal fibroid, that means a fibroid which sits on the outer surface of the uterus. There can be intramural fibroid which is there within the muscle layer of the uterus, and a submucosal fibroid, meaning a fibroid which is located inside the cavity of the uterus. An important question which is asked by pregnant women is that do fibroids grow during pregnancy? So it's been seen that in almost 70% there is no growth of fibroids during pregnancy, but in about 30% the fibroids can actually increase in size during pregnancy, and this is mainly due to the pregnancy hormone estrogen. Now, if the fibroids are increasing in size, can all fibroids cause complications then? No, that is not so. Only about 15 to 20% of fibroids can cause complications during pregnancy. So now let's talk about what are the various complications which can occur in a pregnant woman because of the fibroid in her uterus. The complications which fibroids can cause during pregnancy can be largely divided into two types. The ones which are seen in early pregnancy and the ones which are seen later in pregnancy. So in early pregnancy, the fibroids can cause miscarriage. So it's been seen that in women who have fibroids, the risk of abortion is almost 14% versus 7% in women who do not have any fibroid in their uterus. So this risk of abortion is higher in those women in whom they have multiple fibroids or the fibroid is submucosal, that is inside the uterine cavity. The second complication which is seen in early pregnancy is increased risk of bleeding. So this also happens when the placenta implants very close to the fibroid in the uterus. The complications seen later in pregnancy are prematurity. The women who have fibroid uterus, they have higher risk of going into preterm labor. The studies have shown that almost it is 16% the risk of preterm labor in women with fibroid versus only about 8% in women who do not have a fibroid uterus. And this risk is more if the fibroid is submucosal or the placenta is implanting close to the fibroid. The second complication seen is placental abruption, that is premature separation of the placenta. Normally what happens is that the placenta separates from the uterine wall after delivery of the baby. But in abruptio, the placenta separates prematurely before delivery of the baby. Now, women who have fibroids which are inside the uterine cavity, or if the placenta is implanting over the fibroid, then these are the women who have higher chances of abruptio. Also, malpresentation is seen more in women who have fibroids. Now, malpresentation means that the presentation is not normal. Normally what happens? That the head of the baby, that is occupying the lower part of the uterus. In malpresentation, it can be the buttocks of the baby, or the baby can be in transverse lie, or it can be the shoulder of the baby which is occupying the lower part of the uterus. So now if you have a large fibroid which is sitting there in the lower part of the uterus, then the head cannot present in the lower part, and so generally these women have either breech presentations or transverse presentations. Now during labor also, they have more chances of having prolonged labor because they can go into uterine dystocia. What happens? Because these are muscle growths, so they do not let the uterus contraction happen normally. And so this leads to labor dystocia, which can lead to prolonged labor and which can also lead to a cesarean section. The chances of cesarean section are anyways more in a woman with fibroid uterus. Why? One, like I told you, there can be malpresentations. Second, there is increased chances of uterine dystocia, so their labor does not proceed normally, and at times we need to do a cesarean section for such women. Now, even after delivery of the baby, such women have a higher risk of postpartum hemorrhage or PPH. Now, because of the muscle, because of the growth in the muscle, the uterus is not able to contract very well after delivery of the baby, which leads to increased bleeding. So, these women are always at a higher risk of postpartum hemorrhage. Now, the other question, that strikes us is that do all women with fibroids have the same complications, or do the complications depend upon the number or location of fibroid? Yes, definitely. The complication rate depends upon the number of fibroids, the location of the fibroids, and the size of the fibroids. So, if you talk about number, the risks are definitely less if you have a single fibroid than if a woman has got multiple fibroids. Now, the location again would determine the chances of complications. Now, if there is a subserosal fibroid which is sitting, outside on the uterus, then it generally does not cause any complications. The fibroids which are inside the uterine cavity, they cause the maximum number of complications. Now, if we talk about size, fibroids less than 5 centimeters are generally small in size and they do not cause any trouble. It is the fibroids which are more than 5 centimeters. 5 to 10 we categorize as medium sized, and any fibroids larger than 10 centimeters are large fibroids, and these are the ones which cause most of the problems. Another important question is that should the fibroids be removed during pregnancy? Like if they cause so many complications, why keep them there? Why not remove them during pregnancy? So now removal of fibroids is not recommended during pregnancy because they generally do not cause many problems except pain. Pain is one of the most common complication of fibroid, and this is mainly due to red degeneration of the fibroid. When the fibroid outgrows its blood supply, then a bit of ischemia occurs there, and so the pregnant women might have fever with chills and should have pain abdomen. Only in rare cases, when the pain does not subside with conservative methods, then we need to remove the fibroid. And this removal surgery is generally done in the second trimester, that is somewhere between 4th to 6th month of pregnancy, because operating at that time is safe for the baby. Now, should the fibroid be removed during cesarean section? Now, already one operation is being done. So, if we see a fibroid during cesarean, should we remove it? No, this is also actually not recommended. Unless, of course, you have a fibroid subserosal which is sitting on the outside surface of the uterus which you can remove, or if there is a fibroid which is there on the incision line. Now, to take out the baby, you have to give an incision on the uterus wall. Now, if you have a fibroid which is located right there on the incision line, then of course you will have to remove it to be able to take out the baby. Another important question which is frequently asked is, what if we've had a fibroid removal surgery before we became pregnant? That means that at some point of time before you were pregnant, you've had your fibroids removed surgically, and this surgical technique is known as myomectomy. So, if you've had a myomectomy, it does not always mean that you need to have a cesarean section now, because the mode of delivery would depend upon the extent of surgery. How many fibroids were there, where were they located? So the gynac will review your records and then form your or plan your delivery. So generally what happens is, what we are scared of is that in case you had a myomectomy where the uterine cavity was entered, then the chances of rupture of uterus during labor are high. So that is why if the endometrial cavity or the uterine cavity has not been opened during myomectomy, then it is safe to go in for a vaginal delivery. But if it has been entered during the myomectomy surgery, then we always go in for an elective cesarean section. So please be aware and be safe. If you have any more queries which is related to fibroids during pregnancy, please feel free to ask me those in the comment section. Also, don't forget to like, share and subscribe to my channel, Your Mom Talks. Your subscription means a lot to me.